Good morning, good afternoon, everybody. Welcome to the first in the webinar series on climate and health integration. My name's Sally Edwards, and I work at the WHO Asia Pacific Center for Environment and Health in the Western Pacific region. For opening remarks, I would like to pass over to Dr. Susie Mercado, who's the Director of Program Management. Dr. Susie, over to you.
Hi, hello, good morning, good afternoon, everyone. Warm greetings to all of you. It's a pleasure to welcome you all to this webinar of the Asia Pacific Center for Environment and Health. And I'm Dr. Susan Mercado. I'm the Director of Program Management at WHO Western Pacific Region based in Manila. So we all know how big a challenge climate change is in our time and for this region. We are home to over 1/4 of the world's population, and the impacts of climate are immediate and quite complex. More frequent extreme weather events, sea level rise, and changing patterns of infectious diseases are just some of the current threats that we are facing and that are realities for our member states right now. So the health of our people, security of their food and water, and the safety of our homes and health systems are all being affected by changes in climate. In our new regional vision, Weaving Health for Families, Communities, and Societies in the Western Pacific region for 2025 to 2029, our vision document discusses something that's more important now than ever, and that is building strong connections that protect our health in a changing climate, connections between people, between sectors, and between health and the environment. The global strategy of WHO, as articulated in the General Program of Work, or GPW14, also calls on us to act now to create healthier populations. And of course, that will not happen if we do not have a healthier environment. In this regard, a diverse and cross-sectoral approach is needed to minimize the negative impact of climate change. Health systems need to adapt to climate change, but must also lead by example, reducing their own environmental footprint and championing resilience and sustainability in every part of the system. We have an opportunity to show that health and environmental action go hand in hand. This webinar series is about sharing practical ideas, experiences, lessons learned. And today we are going to find ways to support each other across countries and sectors to build stronger, more climate resilient, low carbon health systems. So we're looking forward to a great webinar today. Stay with us and please participate, interact, and be part of this discussion. Thank you very much. Over to you, Sam.
Thank you very much for your remarks, Dr. Susie. I would now like to pass over to Dr. Sandro De Mayo, who's the Director and Head of Office of the WHO Asia Pacific Center for Environment and Health, for some context setting. Sandro, over to you.
Thanks, Dr. Edwards, and thanks, Dr. Mercado. Thank you, colleagues, friends, partners, for joining us today for the first session of our new webinar series on climate and health integration. It's my pleasure to be here with so many colleagues from across the Western Pacific region and, of course, beyond. My name is Dr. Sandro De Mayo. I'm the Director of the WHO Asia Pacific Center for Environment and Health in the Western Pacific region, also known as ACE. Today marks the beginning of an important series where we want to move beyond raising awareness to really get into the practical, tangible actions that can drive change. Our first focus is a critical one: decarbonising the health system, and of course the broader health sector. As we know, the health sector itself is responsible for a significant share of global emissions, around 5%. Reducing the carbon footprint of health systems is not just an environmental imperative. It's closely related to a range of health issues and health outcomes that affect communities across our region. Every single tonne of emissions reduced means fewer cases of respiratory disease, fewer climate emergencies, and a healthier future for our populations. As a director here at ACE, I'm working closely with countries to find practical solutions to these challenges. Whether it's scaling up renewable energy in healthcare, improving sustainable procurement, or reducing waste, the opportunities for action are within our reach, but they require coordination, technical support, and political will. Today's agenda reflects that very practical approach. We'll begin with an overview from our WHO headquarters colleagues in Geneva, setting the global scene on health sector emissions and what is being done. Then we'll hear expert insights on where emissions are coming from in our region and what practical transitions high emissions health systems can make towards low carbon models. Importantly, we will hear directly from countries, Fiji, the Philippines, Malaysia, on how they are tackling these challenges on the ground and in their countries. Finally, we'll open the floor for a plenary discussion, giving us a chance to reflect, to ask questions, and to explore where we can collaborate across the region. This webinar series is also a platform to build momentum towards stronger regional collaboration. ACE is here to support countries in implementing low carbon health strategies, strengthening capacity, and scaling up what works. I encourage us all to share ideas and look for opportunities to act, to innovate, and to partner with each other and across the Western Pacific region, those who share the same vision for a sustainable, healthy, and safe future. Thank you again for your time and commitment, and I look forward to a dynamic and solutions-based conversation. Back to you, Dr. Edwards. Thank you.
Thank you very much for those remarks, Sandro. Excuse me. And as mentioned, next up, we have some remarks from our headquarters. Given the time difference, I'm sure you appreciate that they have done a recording for us. So if we could play the recording, please, from Miga.
Greetings to all from Geneva. I'm Megha Rathi, the Technical Officer for Environmental Safeguards in the Department of Environment, Climate Change and Health. As we all know, the climate crisis is a health crisis, and WHO has been supporting its member states in building climate resilient and low carbon health systems. At the same time, the health systems generate about 4 to 5% of global greenhouse gas emissions. WHO is supporting its member states to reduce these emissions. At the same time, WHO has committed itself to be carbon neutral by 2030 to reduce the emissions coming out of its operations and programs. This is a mandate that has been provided by the member states in a resolution on climate change and health that was adopted last year, in line with the UN commitment to be carbon neutral by 2030 and to lead by example. This is going to be easy. To be carbon neutral requires us to be working with different partners, with different operations within the organization. It requires commitment from the senior management. It requires commitment from all 3 levels of the organization, from the entire staff. It requires us to be more innovative and to think about, designs that are more environment friendly and less carbon intensive. As WHO, being part of the bigger UN family, has been reporting on our emissions since about 10 years now. The exercise was at the HQ level, now expanded to regions and countries, where we are mapping our emissions coming from various activities, including travel, building operations, waste management, procurement. We see that simple, innovative measures are helpful in this journey. Like we see the maximum emissions are coming from travel. So if we can reduce the amount of travel where possible, we need to move to more sustainable alternatives for travel. And in terms of our fleet management, we are moving towards more hybrid vehicles and not relying on fossil fuels. So these are some good practice examples that are there across the organization. And in terms of building and facilities management, we see that many of our country offices are using renewable sources of energy. We have solar panels. In the headquarter buildings, we have the heating and cooling coming from the Lake Geneva. So we a very energy efficient building. So these are some good case examples, that we are learning from different country level, regional and HQ examples. But at the same time, we are just not focusing on our scope 1 and 2. We are also looking at our procurement and supply chain. We're looking at our waste management. We are working with our suppliers and reducing the emissions from our procurement. We are working on reducing the amount of waste being generated from our operations and programs. We are looking at reducing and recycling where possible, including circularity where possible. So these are some just examples that we are just sharing with you. And we know, as I said, this is a complex process. It's a long journey, but here we are together, and at the same time, while building climate resilient, low carbon, sustainable healthcare facilities, we are committed to have a WHO which is carbon neutral. So thank you all for giving me this opportunity, and very best for you. Thank you.
Thank you for that presentation from HQ. And with that, I would now like to pass over to my colleague, Dr. Enki. Enki.
Thank you, Sally. So following the inspiring presentation of Megha, we are moving now to our next part of the webinar. We have two distinguished experts in the area of health sector decarbonization. So briefly about how we run this session. So we have 30 minutes. I kindly ask our two speakers to deliver your presentations within 10 to 12 minutes maximum. And as Sandra mentioned, a question and answer time part will be towards the end of this webinar. So meantime, I kindly encourage the participants to put your questions and insights in the chat box so we can keep the chat alive. So now I would like to first invite Miss Melody Mela-Rishk, I think Mel, who is a climate and healthcare professional specialized in intersection of climate change and food security. The Mel is the regional climate and health manager at the Healthcare Without Harm in Southeast Asia. So over to you, Mel, for your presentation.
Hello, everyone. Good day. So my topic would be on decarbonizing healthcare in Southeast Asia, focusing on facility levels. So before I start, let me introduce our organization. So in the next slide, I would like to say that for Healthcare Without Harm, we have been existing more than 20 years, and we are an international NGO that has regional offices in Latin America, in the Caribbean, in Europe, in Southeast Asia, and also strategic partners in Australia, Brazil, India, Nepal, and South Africa. So in the next slide, I would just like to emphasize that the vision of the organization is really to transform the healthcare sector to lower their environmental footprint and make sure that we are the community anchor for sustainability and lead the movement towards climate health and justice. So it's basically also reflected on our mission that we want to champion people's right. In the next slide, please. To health and healthy environments. And that is the core, and that fuels our passion for this work that we have in the healthcare sector. So in the next slide, I would just like to say that for the healthcare sector as a contributor to carbon emissions, it's in our publication in Healthcare's Climate Footprint that 5.2 of the net global emissions that we have is coming from healthcare. And if it were a country, it would be the 5th largest emitter. But majority of these emissions are coming from supply chains, around 70%, and the 29% would be coming from scope 1 and scope 2 emissions. In the next slide, I would just like to see the trajectory of the Southeast Asian nations when it comes to their carbon emissions. Basically, we see here that we are not going to lessen our carbon emissions more if economic growth and urbanization would continue. For example, here in this slide, you can see here that Indonesia and Vietnam are projected to experience significantly larger increases in emissions by 2030 compared to other Southeast Asian nations. Brunei Darussalam is highlighted to have the lowest projected emissions in the region due to its reliance on renewable energy sources and primarily on hydropower. So in the next slide, what can be done? So here's where we focus our strategies and interventions. The global roadmap for healthcare and decarbonization that states that if we are doing business as usual scenario, health sector emissions could be more than triple by 2050, and fully decarbonizing by 2050 is possible by using these 3 decarbonization pathways. So decarbonize healthcare delivery, decarbonize our supply chains covering our products, pharmaceuticals, and food, accelerate decarbonization in the broader economy. And with these 3 decarbonization pathways, we will be highlighting 7 high impact actions that would be reliance on 100% renewable energy, investing in zero emissions in buildings and infra, then transition to zero emissions in terms of transport and active travel, so on and so forth. In the next slide, I want to emphasize that for Healthcare Without Harm and Healthcare Without Harm Southeast Asia, we have had our networks of healthcare facilities, and we call it as the Global Green and Healthy Hospitals Networks. So network, generally, it's a community of hospitals, healthcare systems, and healthcare organizations dedicated to reducing ecological footprint in healthcare operations. And the membership is open to any organization that delivers healthcare and social care services in the region. So it may be hospitals, healthcare centers, and healthcare facilities, health systems, even health organizations are invited to be a member of GGHH. And with that, we also want to get their full commitment. This membership is free, and what you get from this membership is the resources that we can offer for you to be a member, and also to support you in your journey towards net zero and decarbonization. So in our resources or materials that we have, one of which would be the climate impact checkup tool. Next slide, please. So this is one of the resources that is recognized already by the attach. This is already in the resource page. You can actually download it. And if healthcare facilities are decided to lower emissions and apply climate-wise friendly healthcare, your next action is basically to create a climate mitigation plan, but you first must know your beginning point or your baselines of GHG emissions if you are to accomplish that kind of plan or intervention. So with that being said, these baselining will help you identify priorities, creation of strategies, and execution of emission reduction in your facilities, in your operations, procurement processes, and it really depends on your baseline. So with that, having this tool would also elevate you to further up your game and or your journey towards your decarbonization through the healthcare climate challenge, and also race to net zero, which I will be discussing further later. In the next slide, just to emphasize that CIC tool was developed using the GHG protocol. Basically, we have in-person trainings, but we also have an online resource that can be accessed by members of the GGHH and those who would want to take the course. In the next slide, so we can see here that for the last 3 years that we have been doing these trainings, so we have had a lot of trainings that are situated definitely in the region, and these are the individuals that were trained for the last 3 years. So in 2024, we had roughly about 200, more than 200 individuals that we trained. As far as the online course is concerned, in the next slide, we can see here that for last year, we have been consistent in increasing our certified trainers, and majority of our certified trainers or those who are subscribed to the course is mainly from Colombia and Philippines. And we have here the total number of submissions in the next slide. So 1,304 submissions of their baseline emissions in 31 countries worldwide. And on the right side, you can see there the submissions coming from Asia. And with that, we also want to recognize the efforts of our members through our Healthcare Climate Challenge. So in the next slide, you can see here that this is really a form of recognition. This was established before Race to Zero happened, so within our members. And with that, we also support, in the next slide, Race to Zero. So it's led by the UN Climate Challenge, high-level champions. And basically what we want to do is to lessen the global emissions by 50% by 2030 and achieve net zero emissions by 2050. So currently, we have 10 RTC healthcare facilities that are participating, and we have around 64 that are participating for the healthcare climate challenge. So in a snapshot, these are the accomplishments that we have done so far. This is a combination already of our work with the healthcare facilities and also our health professionals network, the RISE Alliance for Health and Climate here in Southeast Asia. With that, I would like to end my slide that the cornerstone of the healthcare and medical ethics is really do no harm. And that's what we want to achieve, that in delivering our care and services, we can also lessen our environmental impact and maybe to minimize or even to zero impacts on our healthcare sector. And with that, I would like to connect more to everybody here. I've put here my email and also our website. If you want to check out our initiatives and our interventions, you can check out our website and our social media accounts for further updates and further collaborations. Thank you very much, and it has been a pleasure to be here.
Thank you very much, Mel, for a rich presentation outlining the magnitude of the problem and also healthcare waste without harms activities, and most importantly, highlighting the key approaches for decarbonization to turn the ambitions for net zero into reality. So we wish success to your work, and we stay in touch. And also I kindly ask you if there are any questions, please respond to in the chat. So thank you. Our next speaker is Professor Nick Watts. Nick is trained in medicine and public policy. Currently, he is the director of Center for Sustainable Medicine at the National University of Singapore. Formerly, he worked as a chief sustainability officer at NHS and at UK, and also as executive director of the Lancet Commission, Lancet Countdown. So, Nick, without ado, I would like to give over to you to present the key aspects of decarbonization in the health system. Thank you.
Thank you. Thanks, Anki. Thanks to everyone. Let's be brief, because I think honestly, you can talk about a lot of this stuff in the abstract up at the regional, at the international level. It only really comes to life when we get down to Fiji, Malaysia, the Philippines. So I'd like to leave as much time as we can for the more interesting side of things. I'm so sorry, I don't have anywhere near the level of sophistication of slides that Melody had. I only have this slide. We can skip to the next slide. We can skip one more slide down. And that is all my slides. So I promise you, it's very simple. I just want to talk about three things. Okay. I want to talk about what you do at 9 a.m. tomorrow morning, what the very, very first steps are if you are a healthcare system who cares about this. And I actually think it's pretty simple. Number one, you build the evidence case for investment. A lot of what we want to talk about here, it results in significant cost savings to the healthcare system. There is a reason why the NHS spent £1.1 billion on healthcare decarbonisation, and it's because it makes the NHS, it's because it makes healthcare systems money, because this is good, common sense healthcare. You build that investment case, you get on with some of the no regret work. While we're building up that analytical capacity, there's no time to wait. We've waited for 3 decades too long. You get on with that easy win work, and there's a few things that we can talk about there. And then number 3, you make sure that you think about this not as someone that can do this at 9 a.m. tomorrow morning and then be done, but as a long-term journey. We think about the capacity building required. This is a 10, 20, 30-year journey. Anyone that hires McKinsey to help them do it, I think, is sort of missing the point. The point here is that we are building up a genuinely new capability within a healthcare system that has not previously existed, and we need to take that seriously and treat it with respect. So let's start with building that evidence base for investment. Listen, what you want to do there is pretty straightforward. You need a baseline. You need to know where you are starting today. You need a target, you need to know where you're heading, and you need a trajectory between the two things. It's actually not that straightforward, but let's talk about each of those in turn. When it comes to a baseline, you run around the entire healthcare system, you pick up all of the data that you are able to grab, all of the information on the medicines that are prescribed, on when your patients go home, with what kinds of mobility aids, what kinds of vehicles and hospitals and GP clinics you own, what sort of PPE they consume, everything you can grab. You do some pretty clever multiplication with some carbon factors. It gets a little bit complex because at this point we're talking about 8,000 different lines of code. We're talking about 8,000 or so different data sources flowing in. So the calculation is actually quite large. And out the other side, you get a baseline. Now that baseline here is not actually going to be that sophisticated. In fact, if you go up one slide, if we go back one slide to the pie chart, this here is a rough average of what a healthcare system in the region, what its footprint will look like. For the most part, we will all be sitting here with 10, 15% of emissions in hospitals and clinics in the built environment, 20, 25% in medicines, about another 20 or so in our sort of specialist medical procurement. Depending on how big your country is, if you're Singapore, you can imagine travel might be a smaller component. If you're bigger, if you're China, if you're Australia, sure, a much more significant component of emissions. But you get the idea. For the most part, the baseline looks similar. You set that first point. You set the next point, the end point. Let's just call it 2050. Let's not be too worried about whether or not it's 2049 or 2051. Let's go with whatever it is that that the country or the region is running with. Let's not be too worried as well with what we're offsetting. Let's just assume an industry average. Let's allow 10%, no more than 10% offsets. So we want to get from here and a 90% reduction by 2050, hey? The reason you go and do all of that work to gather those lines and lines of code, to gather all of the data just to produce a diagram that gives you a single number here and the hotspots there, is for what comes next. You need to convince yourself, and you need to really believe it. You need to convince yourself the chief financial officer, the chief operating officer, the chief nurse, the chief executive, the health secretary. You need to really believe that it is possible to get from where we are today in 2025 to where we need to be in 2050. And with all of that data, you can build up this next slide, the ski jump slide, if we could move on just one. It's what we call an intervention cascade. It's actually something called a drawdown model. It's a completely different kind of analytical model to how we build up the baseline. But basically within each of these wedges, you assign an intervention. You assign the carbon attached to that intervention. You assign the cost and the payback period attached to that intervention, the human resources, the political resources, the patient implications, the positives that we can bring for our patients. And you give yourself confidence step by step by step, intervention by intervention, that yes, in 2025, I believe I can do these 4 things. And in 2027, I can do these 10 things. We can build up a little bit of capacity here. And in 2040, sure, I actually think we could get most of the way there. The reason you need that evidence base for investment is because it's what gives you the confidence to go and say, actually, I know that if I do put this money into some of these no regret scenarios, I will make that money back. I will be able to demonstrate success and value for my healthcare system, for my patients, for my taxpayers. So that's the first thing we do, hey? Build that evidence base for investment. The next thing, and this is important, anyone that tells you we don't have enough evidence to act, anyone that tells you that all we need is just more research, tell them to get lost. They haven't been paying attention. We absolutely need more evidence, but we also have more than enough of an understanding to get going now. On-site renewable generation in every country in this region will always be cost effective, always. Energy efficiency measures, depending on the age of the facility you're talking about, will always be cost effective. In the NHS, we were able to even save money with energy efficiency measures on a building first constructed in 1832. If you can save money on a building like that, you can save it pretty much anywhere. The only determination, honestly, is whether or not the return on investment period is the average for a net zero healthcare intervention, which is 3.6 years, or as you get a little bit more difficult, it stretches out 5, 7. The highest payback period, the longest payback period I've seen was about 20 years. Now that's at about the point of break even, because we know that that's at about the point of retrofit equivalency. That's okay. On-site renewables, they'll always make sense. Energy efficiency measures in clinics will always make sense. Surgical and intensive care device reprocessing, that will always make sense. It'll also be a pretty good resilience measure. Getting rid of some of those unnecessary high carbon medicines that often make our patients more dependent on low value respiratory and asthma care, always will make sense. It's the easiest and the quickest of wins. Getting rid of some of the, frankly, too expensive anesthetic gases that we just don't need anymore. Getting rid of some of those high carbon chronic disease management drugs in favor of the lower carbon alternatives, in favor of lifestyle modification. That will always make sense. Electrifying a non-emergency fleet pays for itself in about 5.5 years. We have business cases of this all around the world. Anyone that's worried about the fact that their country, their city, their community doesn't quite have the electrical infrastructure, the charging infrastructure in place, that's okay. Because it turns out that hospitals are maybe the best place in the world to start with electrification. We have 2 things going for us. Number one, we operate our vehicles non-stop. We operate them 22 hours a day. Number 2, they don't go that far. And I lied. The third thing, our hospitals have a return to base function. So we don't have to rely on the charging infrastructure out in community. We just need one charger, back at hospital, back at base, a rapid charger. Very quickly, that will save money. There's these 6 things and so much more These 6 things I picked, frankly, because I think they work in every country in this region, and I think they save money in every country in this region. But if you get a little more specific, very quickly, you will find so many other things. You will find you unlock quite a lot of passion, quite a lot of excitement in the nurses, in the pharmacists, in the doctors across the healthcare system. You build that evidence base, you start with some of that no regret work. And I'm going to finish where I've begun. You focus on capacity building. You make sure that this is not about flying in experts from a long, long way away to do a quick calculation, multiply 2 numbers together, and then say, thanks, good luck. It just won't work. And if you think about it for a second, the reason for that is pretty clear. Because there's some pretty technical stuff we have to be able to do here. We have to be able to get under the hood of every part of a healthcare system, of an emergency department, of a primary care clinic, of our public health surveillance systems. We need to understand where the carbon comes from, what the alternatives are, what the carbon and cost and health implications of those alternatives are. You need expertise embedded, not just to do the first assessment, not just to identify the hotspot, but to actually day by day drive it forward. Because anyone that's worked in a health ministry knows that you can't just produce a plan and then go, God, what a great plan. Thank God we did that. Now that capacity building, that takes time. That can't happen immediately. It doesn't happen in 1 year. It doesn't happen in 3. It takes 5 years. The NHS now has a team of about 150 people working on this full time. Now, not everyone is going to get to that scale, but it's important to remember that the NHS started with 1 person, and then it brought that capacity in. It brought partners in from universities. It brought partners in from some of those expert technical consultancies, and it slowly developed the ability to run its own analytical models. It developed the ability to run its own interventions. And that, honestly, if we're going to be able to do this from 2025 to 2026, 2030 to 2040 to 2050, that is what is required. Building the evidence base for investment so that we can convince ourselves, convince health secretaries, convince multilateral agencies that this is a good place to invest, and it is. Starting with some of that no regret work that we just know is common sense. And then making sure at all times that we are asking, is what we're doing building up capacity in country? We can do these 3 things. I think we're going to have a lot of fun together. Thanks for having me. Thank you. Back to you, I think, Anki. I hope that was okay.
Yeah, thank you very much, Nick, for your very insightful and practical presentation. Our 2 presentations complement each other very nicely. So Nick highlighted, again, the very concrete aspects. He provided a glimpse of emission sources in the health sector, and also highlighted the importance of the evidence-based targets, and most importantly, the cascaded way, the incremental actions to achieve the end journey, the decarbonization. So over to you, Sally, our colleague, to moderate the next session, the country panel. Thank you.
Thank you very much, Enki. So we're now moving on to hear from some of our countries and some of the best practices, some of their experiences, and what they've been able to achieve. So first up, I would like to call on Luciana Umaiwai. I hope I pronounced that right. Lucy, over to you, please.
Thank you, Sally, and good afternoon to the moderators and the previous presenters. I hope I'm heard from the other end as well.
Loud and clear.
Thank you. So good afternoon, everyone, and my name is Lucy. I'm a senior health inspector with the Ministry of Health under the Environmental Health Unit. Firstly, thank you so much for the kind invitation to present on Fiji's stance on the energy, renewable energy in the health system. So next slide, please. So I wasn't sure what the content of the forum would be, but I thought of putting up a little just a brief background on Fiji. And for those of you that are not familiar with Fiji or have never been to Fiji, Fiji is is also known as the Republic of Fiji and is situated within the South Pacific region. It consists of 330 small islands, of which only 110 is occupied. And it has a combined total land area of around 18,300 square kilometers. So for Fiji, it has two big islands, which is Vitilevu and Vanuatu. And these are the islands which consist majority of the population, which is around 87%. Our capital is Suva and is located within Vitilevu. In terms of our weather variation, the ENSO is a key driver of the weather variation in Fiji. And so we only have two seasons, which is the wet and warmer season from November to April, and our dry and cooler season, which is from May to October. Next slide, please. Thank you. So Fiji, the health sector in Fiji is progressing slowly towards the transition of utilizing renewable energy sources within our infrastructure. And we do understand that this also is a significant opportunity for us to enhance a resilience and long-term sustainability and cost-effective energy source within our healthcare provision throughout the nation. As a small island nation, we are particularly at risk from climate change, and not only Fiji, but other Pacific islands as well, and also the unpredictable fossil fuel markets. So we do understand that using clean energy in our healthcare facility will fit Fiji's aim, our national aim, and that is to run on 100% renewable energy by 2050. And we also hope to build infrastructure that can better handle climate change for our health sector. Next slide, please. So in Fiji, so my presentation this afternoon, we will focus particularly on the renewable energy source that is used in our health facility. In the previous slide, it had two types of installation of solar panels. One is the ground-mounted panel, and the other is the roof-mounted panel. And that is the two common solar panels or the clean energy that is used in our health sector in Fiji. So in terms of the services provided by the Ministry of Health Fiji, the Ministry of Health serves all of Fiji under the four main divisions, which is the Western, Northern, Eastern, and Central Division, and it has around 21 subdivisions. And the ministry delivers its services to about 9,000 population, which is the total population of Fiji at the moment. It has 3 divisional hospitals, 8 subdivisional hospitals, over 18 health centers, and 99 nursing stations. So in total, the Ministry of Health administers around 210 healthcare facilities. Next slide, please. So when we were requested to present today, I tried to gather as much information on the renewable energy that we provide in healthcare facilities. Currently, the ministry is trying to progress information and data on the number of solar systems that we have in our healthcare facility, as well as the service that it provides, whether it facilitates the whole health facility or just a portion of the facility. However, I gathered this information through the support on projects within the Ministry of Health. These information that have been implemented within the year of 2018 to 2023. It is the installation of solar panels in the listed healthcare facility. And I do apologize if the map is unclear, but pinned on the map is where the facilities are and where the solar panels have been installed to help these healthcare facility. And in 2 of these facilities, additional work were also done to the staff living quarters so that clean energy is also used within the vicinity. And so for this project, the project encompasses the whole healthcare facility and it provides energy, clean energy to all the equipments within the facility. Thank you. Next slide, please. So we have some planned activity in terms of solar installation in our healthcare facility. We have a number of organizations that have approached the Ministry of Health Fiji and are willing to provide this service and install the solar system within our facilities. So the most recent will be UNICEF, who will commence in July 2025. They are willing to support around 15 facilities and are also planning to do 11 in the next few years. Also recent is the Quaker Shape WHO project, and they are the plan is to install around 17 solar systems in 17 healthcare facilities, all in the 4 divisions. We also have Cure Kids Fiji, who are planning to install 4. And then we have the government agency, which is the Department of Energy, through different support from donors that would like to include health facilities in their scope of work as well. So we have around 13 facilities that will be supported through the Department of Energy. And then lastly, within the ministry, we have a target of around 20 facilities. And these are facilities that we hope to refurbish or upgrade, to refurbish or upgrade our solar panels. And probably just for everyone's information, we have had a number of panels that have been installed in our healthcare facilities within the past 20 years. However, most of them have been damaged during cyclones and have not been replaced, and some have been outdated and needs upgrade. So these have been encompassed in the MOH plan of development. Next slide, please. Thank you. So some challenges that we face in terms of trying to implement renewable energy within the facility, the initial investment cost. We are aware that the upfront cost of the installation of any solar panel or any renewable energy system is very costly, and this can be a significant barrier. And we face this with a lot of donors that have come in that have wanted to assist the healthcare facility, but had to change the scope of work because of the cost implications around it. The other challenge is the infrastructure limitations. Some of our existing healthcare facilities, they still need upgrades of the electrical infrastructure so that it can accommodate renewable energy system. We also have a challenge of land availability, particularly for health facility that needs larger solar installation. And so majority of the time, it's the facilities do not have suitable land that can hold a ground-mounted solar panel, or the roof needs some sort of renovation to hold this panel, and this has become a challenge as well. The other challenge is on the policy and regulatory framework. I think this is an area particularly within the Ministry of Health, it needs to be clear, and it has to support the national and the global commitments so that it can be prioritized in our in terms of development within the ministry. Another challenge is on the financial sustainability and the maintenance. This is an area we also find difficulty in because a long-term financial planning is needed to cover the maintenance, repair, and eventually replacement of any system when needed. Next slide, please. However, we are glad that we still have current activities. We still have interested parties and agencies that are willing to help the Ministry of Health to achieve net zero by 2050. And some of the current activities we have is the Fiji National Energy Policy. And so this is a national policy that outlines the government's commitment to transitioning to renewable energy. And the health sector is also included in this policy. We also have the Korean International Cooperation Agency, who would also like to focus on renewable energy and health projects in Fiji. And they have had a significant portion of their funds committed to sectors that can help the health sector as well. And then we have alliances such as the International Solar Alliance, and this is with the Department of Environment. They they aim to implement solar energy projects in Fiji, and this is currently ongoing discussions with our Department of Energy. And one of the most important activity as well, we had launched our national guideline for climate resilient and environmentally sustainable healthcare facility in 2021. And this is an area where we've been, and it's a document that also includes energy efficiency and the adoption of renewable energy as one of its key components. And this is where we have been deriving the need for our healthcare facilities to have renewable energy sources. Next slide, please. Ladies and gentlemen, just to conclude my presentation this afternoon, we do understand that scaling up the renewable energy in Fiji health system is very crucial because this is our step towards reaching our commitment for 2050. as well as improving a sustainable and resilient and equitable healthcare future for the nation. And we hope that the challenges that we have, by addressing it and leveraging the opportunity and partnership with our other sectors, will play a significant progress in the vital transition of Fiji health sector from the current use of its energy sources to clean renewable energy sources. Thank you. That's all from Fiji. Nakawalebo.
Lucy, thank you very much for bringing us down to the ground and showing us some of the great work that's been done in Fiji, but also showing us some of the challenges that you're facing and bringing the issues of disasters and land as well to the forefront. But exciting also to see the partners that you're working with and the path that you're on. So thank you very much for that. I would now like to move on to Dr. Ronald Law, who will be from the Department of Health of the Philippines, who will be talking about current decarbonization initiatives and plans in the Philippines. Ron, over to you.
Thanks, thanks, Sally. I hope I'm coming in loud and clear.
Loud and clear.
Okay. Good morning again. Thanks for having me here. Again, I'm Ron Law. I'm my work is to direct we have here in the Philippines a newly established Health and Climate Change Office. So what our job is to help orchestrate and make sense of the different actions of our health department as far as climate change is concerned. And then thanks, of course, WHO, particular ACE for organizing this webinar and for having our island nation, the Philippines, present our decarbonization initiatives and plans. And I can say that, that the hearing from the Fiji journey, I think it's very inspirational for a country like us, because the Philippines is an island nation. We have a bigger population of around 116 million. We have more than 7,000 islands, and in total, we have more than 40,000 health facilities. And but more than just a number, this represent areas where we can, establish some good practices in terms of decarbonization. So it's really the pleasure of the Philippines to share and learn from the good practices of other countries. I'm not sure if we have enough of this, but we are taking this journey on with a lot of hope and, of course, with a lot of support coming from you. And we believe this is a very important topic to start your webinar series. To start off, in terms of context, the Philippine health sector, for so long a time, we were associating climate actions with adaptation work. And this should be understandable because of the heavy burden that we face from devastating typhoons and floods. And now we're facing extreme heat and, of course, the increasing incidence of climate-sensitive diseases and conditions. So as a country that's highly exposed and vulnerable, we have to be highly adaptive. But through the years, this is the turning point because of growing evidence, and thanks to WHO for this work, of the health sector's contribution to emissions, the 5% that we are all talking about, and the pervasive thinking, or if I may say common sense, that if we directly address the root cause of climate change, then we can also reduce health impacts and create a health future for all. So very important for Philippines because we are pursuing universal healthcare. So this is our paradigm shift. So from doing adaptation only, we are committed to doing both adaptation and mitigation recently and in the years to come. And we believe the first concrete way to realize this is to take the decarbonization route. So this is the way to go. And if you're not taking this route, I would agree with Nick, you better get lost. So this is the way to go. So I will do my best to share our journey in the Philippines. So we decided to be more practical for this presentation. So for our presentation of decarb actions, I will share first what we have done. Maybe this can be our accomplishments. Second, what are being done. So this should be the most exciting part. And this is where all our collaboration is headed towards our current initiatives. And finally, you might be interested to know what our plans are in the short term. And what are things that are to be done, because health at the end of the day is just one of the players, just one of the sectors. But we believe cross-sectoral collaboration is something that we need to also do in the long term. So for our accomplishments, so this is the done column. We have already developed, of course, with the technical assistance of World Health Organization, our green and safe facilities manual, and to go with this, what we call our green viability assessment tool. So this manual, which was actually released almost 4 years ago, aims to address the impacts of climate change and minimize, of course, our health sector carbon footprint. And we also relate this with patient safety by looking at environmental quality, site sustainability, even waste management, and of course, energy and water efficiency. So this is a set of minimum standards for health facilities to follow, while the GVA tool assists users in applying the manual standards to operationalize it. We have also successfully integrated green hospitals, this important concept, in our current 8-point action agenda. So aside from the fact that we now have a dedicated office, thanks in large part to our bold and committed leadership. So this is the first health roadmap that includes something about climate resilience and environmental sustainability. So this is a big consideration in many global projects that we are undertaking. So for example, we also have a World Bank resilience project. So we make sure these concepts really are something that we implement in the projects. Something must be said about our being welcome, being part of the attached family. So when we were formally welcomed to the attached family a year ago, technically, right, Sally? It's inspired by our participation at COP28 in Dubai. We have committed not only to climate resilience, but also to decarbonization. So I think this is something that we have to go back to every now and then. So looking at the value of having a clear direction, we also thought of developing a roadmap. And we did this roadmap, again, of course, supported by the World Health Organization. And we also did a lot of work, of course, consulting with partners. And some of you are represented here. So this roadmap has a mitigation component and decarbonization strategies. So this is something that guides our program now. All right. So going to the middle part, the being done column. So for current initiatives, this is the heavy important work that we're doing now. We are implementing guidelines and standards for green and safe health facilities. So it's part of our program in the department. It's being done across the nation, but we hope to also include a lot of we're also dealing with private partners here, private hospitals. So this includes healthcare management and even WASH in health facilities. So this includes an assessment tool for green viability, healthcare waste management, energy audit, and WASH fit. So we believe these are important areas where we can do where we can make a lot of difference in terms of the decarbonization. We're also in the process of enhancing our Green Climate Fund proposal. We have a GCF proposal, and we have already added a mitigation strand to it. So unlocking finance to support this, we believe can also hasten the implementation of our plan. So enough of the evidence. So we want resources to get things done as soon as we can. And this year, I believe I would like to highlight this. We're very excited to announce that this year, talking about the need to start with baselining before we're able to identify the hotspots, before we can implement the specific interventions. Of course, something must start with doing a comprehensive baseline emission. So we'll be doing a comprehensive baseline emission of our health systems with tailored data set of emission factors. And then we're going to supplement this with an analysis of GVA data because this is something that we work on already. So we'd like to integrate it with emissions tracking. And thank you to the Asian Development Bank for funding this. And of course, we're now being supported by NUS, the Center of Nick Watts here. Their amazing team at the Center for Sustainable Medicine on this. And of course, we were also heavily supported before and even now by Healthcare Without Harm. So we just had the orientation a few days ago, and we really cannot wait to undertake the specific activities that we are planning for. So I believe this is important update in terms of where we are now. But in order to mainstream mitigation work in different aspects of our health system, in health facilities, in communities, in all the offices, from national to local levels, we are currently doing a policy review. And we're also set to develop and amend our health sector policies. So it's very important that we have access to evidence. It's important that we know what the good practices are because we have the perfect opportunity now to package all of this into policies that we will make sure to implement across the nation. So what are our plans? So of course, as soon as we have data and findings from our baseline emissions, we want to integrate health in our government's nationally determined contributions, our NDC. So it is very timely that we are updating our NDC document. And with this, we hope to also have our NDC health implementation plan in the near future. So now we're busy implementing our adaptation plan, but we are very committed to doing the other important part of the plan, which is the mitigation, and that is by way of the baseline emission. So as soon as we have data, as soon as we're able to find the hotspots, but offhand, this should be our, of course, energy. This can be through our waste management, supply chain. So we are also keen on implementing programs and projects related to this. So we are now also in the process of priming our colleagues, different offices in the ministry to do, real mitigation work. And but we need evidence. And when we have this plan, of course, we want this to be costed as well. So we can also come up with a very comprehensive investment plan. And of course, we want to access finance. We want to know about the latest technology, of course, through partners like you. So capacity building, I believe, is very important. So we're also looking at training our personnel in mitigation and NDC work. So all of these things that we are availing of, this should be things that our people should also know about. And we might be setting this to be a new competency in ministries of health. But we are very excited to learn and take these things forward, of course, with a lot of experience that we will have to have. So capacity building is an important priority. And while we are on this important decarbonization journey, it's also important, I believe, that we are able to document our process, our gaps, our learnings, of course, and things to improve on. So we believe this can be shared with our community of practice and of course, presented in important gatherings like attached meetings, the World Health Assembly, and certainly at the COP. And so what's the big picture for the Philippines? So when we think about this, we're happy with our accomplishments, the little the few accomplishments that we have, but we're also excited about the directions we're taking. But at the same time, we are quite anxious of what challenges and issues may affect our implementation. Of course, this is natural. And of course, even the ways forward. But with the strong support of the WHO, with your validation, and of course, the many learnings that we can gain from collaborating with countries and partners present here, we believe our good plans on decarbonization will really materialize, Nick, not just a plan, and really make a difference, I hope, in the lives of Filipinos who, as we know, are disproportionately impacted by this climate crisis. So our Department of Health, with the leadership of Secretary Ted Herbosa, is so much looking forward to this collaboration. And we can't wait to see some actions and results coming when we start working together, especially in terms of the baseline emissions. So thank you for your attention. I'll stop here.
Salamat, Ron. Thanks a lot for bringing Philippines experience to this session. Really interesting to see what's been done, what's in process, but also where your path is leading you. And, you know, we will continue to support you on that journey. Just a reminder to everybody that there is both a chat and a Q&A section of the webinar if you want to ask any questions to any of our panelists or to WHO. So please feel free to use that before we open up. Next on our list is Malaysia. Unfortunately, Dr. Rahman could not be with us in person today, but he has sent a recording to give us an insight into the experience of Malaysia. So if we can play the recording, please, from Dr. Rahman.
Thank you very much. And very good morning to everyone. Today, I am truly honored to share Malaysia's experience from adopting greener technologies to fostering environmentally responsible practices throughout our healthcare system. And as you know, that climate change is already impacting public health in Malaysia. Floods, heat waves, and water insecurity are direct threats to both the public and our healthcare infrastructure. And we are also seeing shifts in disease patterns, such as the rise of vector-borne disease as temperature increase. And our hospitals witness to this crisis, and so it is critical for healthcare systems to be part of this climate solution. And the healthcare sector itself contributes around 5% of global carbon emission, higher than the aviation sector, of course. And this shows an urgent need to transition to sustainable practices. And more importantly is sustainable healthcare facilities not only lower emissions, but they also reduce operational costs by up to 30% and create healthier healing environments for patient recovery. And our journey starts with building a strong foundation. First one, we implementing structured energy management programs and also improving indoor air quality. The third one is we practicing sustainable waste management through 3R principles and also pursuing green building certifications. And now let me share real or on-the-ground projects that we have implemented so far. For solar PV systems, we install for self-consumption at healthcare facilities, helping to cut fossil fuel dependence. And we also use solar thermal systems for hot water generation and even solar absorption chillers to convert sunlight into cooling. To further improve this energy efficiency, we retrofitted our facilities with ASU, LED lighting, and so on. And for water conservation, we implemented rainwater harvesting system, and we also upgraded motors to high efficiency hybrid magnetic motors for our hospitals. These are real examples of how renewable energy and low carbon technologies are being scaled up across our health system. All these efforts that we have taken have already delivered significant results. So far, Malaysia's healthcare facilities have saved over 1,000 gigawatt hours of energy, as you can see in this slide. And also we achieved cost savings of 429 million ringgit Malaysia. This translates to reduction of 775 tons of carbon dioxide emission. And through our 3R initiative, we also create revenue around 7 million ringgit Malaysia. And these achievements shows that sustainable healthcare is not just a vision, it's already making a measurable impact. Our goal is not just to be greener, but to be more resilient, sustainable, and environmentally responsible. We want to be resilient to climate shocks, sustainable in resource use, and also responsible stewards of the environment we depend on. In 2015, and to structure this transformation, we launched the Carbon Neutral Healthcare Facilities Blueprint in 2023. This framework covers 4 main focus areas to reduce GHG emission through green technologies and mobility strategies, ensuring a safe and comfortable environment indoors, promoting green and smart building practices, and working towards achieving full carbon neutrality. And this blueprint aims for healthcare facilities in Malaysia to reach carbon neutrality as early as 2045. And it also addresses indoor environmental quality, green procurement, operational efficiency, and principles of the circular economy. This initiative also shows our commitment to not just mitigation, but full climate adaptation in our healthcare systems. And charting our way forward, we focus on these 4 strategic pillars. I think I've said this in this previous slide. We want to adopt renewable energy, operational efficiency, which we want to optimize our resource use. And of course, we want also to reduce our emission by implementing low carbon technologies and resilience to climate shocks by ensuring healthcare services continue despite extreme weather. I think finally let me close with this. When hospitals go green, they don't just save energy, they save lives. And every decision we make today to reduce emission and promote sustainability will be strengthen our healthcare system of tomorrow. Together, we can create a healthier, more sustainable future for Malaysia and the world. Okay, thank you very much for your attention. Thank you.
So a third fantastic experience from one of our countries. I really liked how they talked about, or how Dr. Rahman talked about, not only the use of renewable energy, but also looking at energy efficiency, but operational efficiency, as well as resilience to hazards. So these are themes that have been brought up throughout the 3 presentations from the countries. So with that, we have a few minutes left. So I would really like to open up if anybody has any questions. We have a few questions in the chat. So there is a question about the magnetic chiller and how does it work? And I think that was probably in reference to Dr. Rahman's, but maybe somebody else has that information and could speak to it. There's also a question from Mel. for Mel, excuse me, about the contacts of consultants and things. I think you've answered that, but please let me pass over to you now. Thanks.
Okay, thank you, Sally. Just to put context on the CIC tool. So the CIC tool is developed by Healthcare Without Harm, and we do the trainings for them in person. So whether it's coming from the Ministry of Health or specific facility, for example, so these requests will be catered by Healthcare Without Harm, but we try as much as possible to endorse it with the Ministry of Health. And of course, we want to have a long-term engagement and make sure that health facilities will do their baseline assessment. So as far as the consultants are concerned, the ministries of health and or the facilities may or may not have consultants for them to get and ensure the accuracy of the data that they provide in the CIC tool. What we have is the pool of trainers that we have trained, both coming from the facility and also from the Ministry of Health, because we try as much as possible to involve them in this baseline tool trainings. So I hope that answers your question.
Thank you very much, Mel. And then a comment. So it's nice to hear about the initiatives in several countries. A crucial point is that how we measure our progress in decarbonization, starting from the baseline assessment. Do we have a methodology and tool for greenhouse gas emission assessment in health systems? And what's so this is a work in progress. We are working, but on this at the global level through Attach, there is a task team, but maybe I can pass over to Nick to explain a little bit about that task team very briefly.
Yeah, sure, happy to. On the, you can hear me, right? I unmuted myself successfully. Outstanding. Yeah. So the question has sort of two parts to it. Is there a set of methods and is there a tool? Let me tell you some good news and some good news with an asterisk. The good news is, yes, as Sally says, absolutely. The WHO has set up a task team with basically everyone that knows anything about low carbon healthcare contributing in to agree on, let's call them minimum viable product, basic standards for what every healthcare system should be able to meet in terms of what you need for a healthcare system to footprint that. Think of it as something that is going to tell you what should be in scope, where the data should come from, what sort of models are best used, which of these sort of complex matrix input-output models we should use. That I think we're aiming to have out and in front of the world in time for COP at the end of this year. That'll be good. The asterisk I want to add is that the other half of the question asks for a tool. And I want to tell you that anyone that says that they have a tool that can calculate the emissions of a healthcare system is lying to you. There's no such thing. We've been involved now in running this sort of process for quite a few healthcare systems. It's just too complex. I unfortunately have worked in the United Kingdom where we had hospitals and health systems come to us and say, Nick, McKinsey, Arup, all of these different healthcare systems, they've developed a tool for us that makes it so simple. All we had to do was pay 200,000, 300,000 pounds. It's a great deal. When we looked under the hood, they were multiplying two numbers together and I'm sorry, lying to their clients. And it was a real shame. This stuff is complex. And that's why I want to focus on that national level capacity building, because we need to build up the ability to not just multiply those 1 or 2 or 10 numbers together, but actually understand the data and the evidence behind it. There was a question about the magnetic chiller. I'm a doctor, not an engineer, but we have a couple of these in some of the healthcare systems I'm familiar with. Basically, at its heart, warm air, cold air, and you have a compressor. That compressor is where most of the energy goes in to cool the air. Usually in an HVAC system, they are mechanical. They have lots of whirring parts, lots of fans, pumping and trying to shrink down the sides of the air to cool down the air as it flows through. In a magnetic chiller, you supercool it and then it floats. And so the fan belt is actually floating. There's no mechanical part there. It reduces the emissions or the energy input requirement significantly. It's very complex to run. So it's not something we recommend unless you have some pretty clever engineers and not Australian doctors talking about how to do it.
Thanks, Nick. But thank you very much for that, and also for the question around what the task team's doing, and really emphasizing the point of building capacity, because at the heart of WHO, that's also what we is central to our main mandate, is building capacity at the country level. So with that, I know there are added questions. We will try and get back to you in writing about some of those questions, but I would like from my side to thank everybody for participating today, but hand over for some reflections and closing remarks to Sandro. Sandro, over to you.
Yeah, thanks, Dr. Edwards. And it's been such a privilege for the last 90 minutes to sit here and listen as our colleagues and, of course, experts across the region, our member states in particular, have shared so generously insights, really practical insights on solutions and actions and shared learnings. And I've certainly learned a lot, and I think it's been a fabulous webinar, and a big thank you to all of those that have made it possible to happen today. As we come to the end of today's session, I really want to take a moment to truly recognise the value of what we've shared together in a little more detail, though. We began today by setting the scene globally, reminding ourselves that the health sector must be a part of the solution to climate change. Then we heard practical insights into the major sources of emissions within health systems, and importantly, what strategies exist for making real, measurable reductions. Hearing from our country colleagues, Fiji, the Philippines, and Malaysia, was especially inspiring. Their experiences show us that low carbon transitions in health systems are not just theoretical. They are happening right now, and we can learn from one another, share best practice, and go further together. Facilities are already being powered by renewable energies. New approaches to healthcare waste management are being implemented. Sustainability is being built into the core of health policy and hospital design. But we also heard clearly that challenges remain. Technical support, financing, and cross-sectoral collaboration are all essential if we are to scale these efforts across the Western Pacific and beyond. This is why ACE exists. Our centre is here to work with countries to provide practical tools, technical advice, and spaces like this one where we can share, learn, and build momentum together. Today's webinar was just the first in a new series. In the coming months, we'll continue to explore different dimensions of climate and health, how to strengthen climate resilience in the health sector, how to reduce environmental impacts, and how to bring innovation and leadership to the heart of health systems. I encourage all of you to stay connected, to bring your questions, your ideas, and your experiences to those future discussions, as you have today. Climate change is the defining challenge of our time, but it's also a defining opportunity for the health sector to lead, to innovate, and to build a healthier and more sustainable future for all. Thank you again for your engagement, your leadership, and your partnership, and I look forward to seeing you all in our next webinar and to continuing this vital work together. Thanks, Sally.
Thank you, everybody.
Thank you.